And thanks everyone else for joining us today. I know this isn't our regularly scheduled meeting, but we had lots of people with various conflicts that came up last month. Camille, do you happen to know if Arthur is going to be able to join us? I had heard from him, I think yesterday, and he said he would.
Yeah, my understanding is that he will be joining.
Okay, great. Why don't we go ahead and get started? We can skip the approval of the August minutes until we have a quorum, but get into some of our updates here. So in case anyone is on here who doesn't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health, and I chair the Consumer TAC. And we'll do introductions of our other TAC members. Miranda and Christine, would you like to introduce yourselves?
Hi, I'm Miranda Brown. I'm the outreach coordinator for Kentucky Equal Justice Center and serve as a member of this TAC. And I'm a connector.
Hi, I'm Christine Jackson, and I am a volunteer with AARP and a client myself.
Thanks. And I think I saw Arthur just come in. Arthur, oh, there you are. All right, great. So if I'm doing the math right, we have 4 members of our 7 total. One of our seats is not filled at the moment. That's the one appointed by the Kentucky Association of Community Health Workers. And I have had some good conversations with them. They're still working on identifying a person to serve, but we should have a quorum with 4. So we'll move forward with a quorum, and we can go ahead and review some of our August minutes.
He said, read that.
I see that. Thank you, Arthur. So your home health aide is off sick and you don't have someone to interpret your speech. Okay. Well, I'm sorry that you won't be able to contribute as much during the meeting, but if you'd like to type any of your comments or questions into the chat, we can definitely make that work.
Thank you.
So have people had a chance to review the minutes? Any questions or any corrections that we need to make?
The minutes look fine to me.
Great, thanks, Miranda. In that case, I will take a motion to approve the minutes.
I motion to approve the minutes from August.
Right. A second?
I'll second it.
Thank you, Christine. All in favor, say aye.
Aye.
Any opposed? Okay, motion passes. And we'll move on to item 3 of our agenda, Medicaid enrollment and recertification. So we've been regularly asking about enrollment numbers and would like to note how many Kentuckians currently are covered under traditional and expanded Medicaid, as well as those covered under presumptive eligibility.
Hello, this is Lee Geis with Medicaid.
I can show you my face if you'd like to, if you would like to see it, but for right now, for PE, we have 1,328 as of this morning. And if you heard my dog moan just then, it was my dog and not me. And then our total Medicaid members without the PE is 1,593,300.
Thanks, Lee. Do you have the breakdown between traditional and expansion by any chance?
I think I can take a look at that really quickly. We have two different reports, and of course I picked the one that doesn't break it that way. Hold on one second. So the expansion number is 580,949.
Okay, great. Well, and we can do the math to get the traditional. So it's about 1,000 or 1,000,000, it looks like.
Right, close to a little bit over 1,000,000 or right at 1,000,000.
Okay, thank you. I appreciate that. Any questions about enrollment? I guess pretty straightforward. And these numbers are, for the most part, at least the total number of enrollment and PE is available on the Medicaid website, but not always broken down between traditional and expansion. The next item is really just a question about whether we can get that new Medicaid and CAID-SHIP enrollment report for children updated on a monthly basis and added to that statistics page on the DMS website.
Okay, so that report is on DMS's homepage. Well, the link for it is on DMS's homepage.
Right, and that's the link that I posted here. I haven't looked at it this week, but when I looked at it, when I was making the agenda, it was the same report that was originally posted
In
maybe a month or
October.
two ago.
Right, it was
Yeah.
posted in October. And what I found out about that just today, Emily, is that this is a newly created report,
Right,
and it's still under construction. Once that was like the first iteration of it for October. And the second iteration will come with the November statistics, but it won't be posted for a little while yet. And then it will be updated monthly. Just
Okay.
gonna have a little bit more information on it. Will contain the traditional Medicaid children as well as the CHIP and CAID-SHIP.
that's great. Can it be posted on the statistics page just so it's easier to find?
Sure, that shouldn't be a problem. We should have had it there. We'll probably have it there once we get it, finalized and finessed completely. Okay.
Yeah, thank you.
Sure.
That definitely answers our question there, and it is a very helpful report. It's great to see children, separated from adults. So thanks for the additional information. Our next item is, or question, I guess, is after, Medicaid open enrollment began on October 15th, connectors have been reporting a number of system issues with some notices, phone line issues, and all of these are creating barriers to enrollment, recertification, and switching MCOs. So we're wondering what is currently being done to address these issues. I'm sure that there are some, system changes in process. I know there's been staffing issues with DCBS, but just wondering where things are at with some of these particular problems.
Well,
And I put a link there to a list of what those issues are.
okay, so we have processes in place, and outside of open enrollment, so they're always in place. When there are phone issues, there's a process for that. It seems to be working. I haven't seen any undue delay in repairing any system issues that have or dealing with any system phone issues that have lasted any longer than 24 hours, except perhaps one that lasted over a Saturday. And sometimes those things just happen, equipment breaks down every once in a while, unfortunately. But we have, I think, some pretty good systems in place to deal with issues like this that arise. The biggest change for the eligibility system would have come, that would have been in place by October, was maybe perhaps some of the changes that went in to prepare for the SBE open enrollment, the state-based exchange open enrollment period that started in November. But I hadn't heard, to be perfectly honest with you, I hadn't heard that there was an enormous amount of issues other than perhaps with some immigrants. And I'm sorry, Emily, I didn't realize that was a link on your agenda, or I would have gone to look at it.
Yeah, no, that's okay. If you do want to take a look at it though, and maybe get back to us if you have any other questions or, information about things that might be in the works, that would be great. I know that Miranda as a connector has probably experienced some of the issues that are in that report, and Priscilla is on here as well, another connector who has been reporting some of these issues. If either of you want to share a few of the things that are most affecting Medicaid enrollment right now.
I know that Priscilla's been gathering input from lots of connectors, so I would love if you want to pipe up, Priscilla, but for my part, I can say that it's just difficult in that, like, a lot of the cases that I enter have one problem or another. And some of that is just related to, it's a new website and there are lots of kinks to work out, but there are also issues with the phone system, people not being able to get a call back if they call on their own. And then just even when we call as connectors, having a really long wait time. And I've had several cases recently where, and this is something that has been reported to KHBE, that they appear to be gradually working on, but haven't mentioned a system-wide fix yet, is that some immigrants who I know are not Medicaid eligible, but should be getting a qualified health plan, are being processed as Medicaid eligible, which is obviously holding up their enrollment into what they should be getting. And also, yeah,
that's the one issue, Miranda, that I have been aware of, and we are digging into it to see exactly what the issue is and why they're incorrectly qualifying for Medicaid. I know that there are a couple of specific, we've gotten some specific cases to look into, and there have been some issues where we have consumed some data from the federal marketplace, and then some of the individuals have come in to apply again, and that's caused an issue with some of those cases. But in others, it's really unclear what has happened. So nailing down the specific cause for that has taken a little bit longer than we would prefer, but we are looking into that one. Digging.
It may have something to do with the eligibility during the coronavirus. Many people got sick and they qualify for emergency Medicaid. So that might be some of the reasons why. See what I'm saying?
Yes, ma'am. it also could be some systematic issue where we have tweaked the system to take care of our, maintenance of effort. And when you tweak a system, sometimes you don't know that you broke something else until you get a whole bunch of new people coming into it, and that's one of the issues. Usually, if someone has gotten emergency Medicaid and they're known to the system, when they come back and apply for regular Medicaid, they should match up, and we should be able to make a better determination about their Medicaid or QHP eligibility, but that's been a stumbling block. So yes, we're looking into it.
Thanks, Lee. And was there something else, Miranda?
No, I was just going to say thank you, Lee. And I was wondering if Priscilla wanted to add anything.
Priscilla said that she is on the phone right now with one of her clients that she's helping to enroll. But she said there are some smaller tech issues, and a lot of them are related, we believe, Lee, to the SBM integration. But, regardless, they happen to be affecting Medicaid enrollment. So I would just suggest taking a look at that report that I have linked there, and maybe we can have a separate call to discuss it, in more detail. But it may be that we're unaware of some things that are being fixed in the background. But right now, people have been struggling to get certain, applications either updated or just kind of getting the runaround on the phone. And we know that, the Medicaid open enrollment, to change your MCO, we only have about 2 more weeks where people can do that. So I want to make sure that any of the issues that they may be experiencing can be resolved so that they can make that selection in time. Other Medicaid enrollment issues obviously are ongoing, and we have a little bit more time to work those out. But let us know if you have any questions or want more, examples or clarification after you take a look at that.
I will do so.
Thank you. So then our next question is why connectors no longer have access to hospital PE applications. I think we were told maybe a couple of months ago that was changing, and we just didn't understand the reason behind it.
The reason behind that is because the Office of Health Benefit Exchange asked us to remove that accessibility, to remove that role from connectors at least until after open enrollment.
I see. Okay, so it's possible that it may be reestablished.
It's possible, but connectors are contracted with the Health Benefit Exchange and not directly with Medicaid. So they will be making that decision.
I see. I mean, there are also connectors or CACs that are not contracted with KHBE, but I understand what you mean by
Right. Right.
Could I ask a follow-up question to that about this?
Okay.
So I know that connectors can no longer do it through our connector accounts, but the link from Connect, the link to temporary COVID-19 coverage, is still active. And so consumers can still fill it out on their own. But I let a consumer know that they could do that, and then she didn't receive any response at all for multiple weeks. And I think we wound up, and we did a QHP application for her, but that couldn't go backwards to when she needed the PE. And so I was wondering, is that still an active form? Because it's still linked on the Connect website.
As far as I understood, it was still an active form and was in fact being worked, just not by connectors. So I suppose I'll need to check into that.
Yeah, and I had understood from, I think it was a conversation with Commissioner Lee at some point, that public forum was going to be, if not permanent, at least for the foreseeable future was going to be available. So I don't think that is tied to the hospital PE, back end access. But I think what you're saying, Miranda, is that whenever a consumer can fill that out, but then a connector can't assist with it, that causes some confusion and potentially, you can't move forward with a regular Medicaid application not knowing their status.
Well, yeah, it's that when a consumer submits it on their own, they don't get any verification immediately that it's been submitted. Like they don't get a confirmation email, that kind of thing. But in the case of this one person I was assisting, I helped her call after she submitted the PE application, like a week or so afterwards, and they could find no record. The Connect call center or DCBS could find no record of her PE application. So that was concerning to me.
Good to know. Something you said, Emily, made me think of.
Well,
Yeah.
Miranda, hi, this is Veronica Cecil with Medicaid. Can you send us that person? We certainly would want to track that through the system and find out what happened to it.
What information do you need? Because obviously I don't have a case number.
Oh, name and social, or if there's no social, then date of birth, or
Yeah,
Just
name
something
and date
that-
of birth would work.
yeah. Thank you.
Thank you.
Right, thanks for helping us look into that. And I would assume that this may be happening with some other cases as well. Miranda's not the only connector we've heard from who is struggling with not being able to support some of their clients with those applications. So,
Oh, I know what I wanted to add in there. Thank you, Emily, for saying struggling with clients. Again, that's the thing. The PE application has been added to self-service portal for individuals. So they can, in fact, go into the mobile app and, it is a little bit cumbersome to create that COG account, but they would be able to apply for PE themselves through the application.
so
The
Through Connect.
SSP, self-service portal, Connect.
through Connect. That's good to know. So is it the same application, just a different, it's obviously in a different location. It's in Connect rather than that standalone web page, but is it the same?
It's not the standalone web page,
Right.
but it should be what the connectors were seeing when they were, because PE is only in the self-service portal, period. So it's just who can access that application, but the applications, when we updated self-service portal and the application and how different it looked, PE applications were updated at the same time because it's all part of the same module, is what I'm trying to say. So systematically, yes, it should look the same as what the connectors were seeing in self-service portal, not that standalone web page form.
Okay.
Does that
So
make
now
sense?
people can access it through the public facing standalone page that you don't have to log in to have a COG account and log in, or they can go to the SSP, log in and access it through Connect.
Yes.
Okay. And if that individual is a client, has a connector assigned to them, would the connector be able to see that PE application if it was through the portal, through Connect?
Were you able to see the I don't know that, because I'm not entirely sure about the connectors and what their access always is. So I think that you'd be better suited. I think HBE would be better suited to answer that question. When you have your connector meetings.
Okay.
Because I'll be guessing if I answered that.
I see.
Yeah, now I have questions for KHB about what it appears like and how I should walk a consumer through that. But thanks, Lee. That's good information.
Certainly.
Yeah, that is good information. And Miranda, if you don't mind bringing it up to the KHB, that would be great. And I see that Patty has joined us. Welcome, Patty. I'm glad your connection is strong right now.
Yeah.
So we've just been talking about various enrollment issues and
Yeah.
how things are going with open enrollment in particular. So should we move on to the next item, Miranda? Okay. So this is really something that Miranda has brought to us, and we discussed it to some degree at our last meeting, but I think at that time you were looking into the issue of certain individuals getting PE coverage initially who really need emergency time-limited Medicaid ongoing. And so what we're wondering is if there's a way to either fix this so that these individuals can get emergency Medicaid, or if providers, can use the HRSA fund.
Well, I think you know that the HRSA fund is in fact part of a provider's choice. They have to enroll and bill us. I don't know if they have to enroll. They have to bill at a certain place that doesn't have anything to do with Medicaid. So we try to post all of the HRSA updates that we get on our website and push it out. I think, I don't want to speak for them, but I think the MCOs are posting that information as well. We have tried to post everything we can about emergency time-limited Medicaid. I think we've talked about the fact that we're updating that emergency Medicaid so that it won't be time limited much, or at all, won't be time limited anymore. But that, of course, is going to take some time. I can tell you that we are trying to implement some changes in our current process that will assist us going forward. However, DCBS is, we have to wait until they have a few minutes in between the SBE open enrollment and the end of the year to talk about changing any of the processes for time limited emergency Medicaid at this point.
Okay.
So we generally, for these two things, have to rely on community partners and our MCOs to help us with educating.
And Miranda, do you have other questions?
Just sort of a follow-up to the last meeting where we had brought up the issue of some people during the pandemic were enrolled in PE when in fact they had an emergency and maybe could have gotten emergency Medicaid, and then their PE ended, and in some cases people have had long COVID and really lasting symptoms for which maybe they could get emergency Medicaid extended, but they didn't have emergency Medicaid. And so the question that we had, or that I had last time, was if somebody had PE that ended and the triggering event where a provider signed them up for PE is over 3 months in the past, could that still be, like, could they still enroll in emergency time limited Medicaid even though their emergency was more than 3 months ago? Does that make sense?
Well, under the current processes, unfortunately, if you went into a DCBS office, the answer to that would be no, because of the way that it's been phrased. And what you phrased was the emergency event was more than 3 months ago, but what you said to me, or what I heard, Miranda, was that they're still suffering consequences of that emergency event. Is that correct?
Right. So you're saying that if they still qualify as having an emergency, then they could qualify for emergency Medicaid for now going forward.
That's what I'm trying to say. Yes.
Okay.
So, right, you would want to be able to just reframe that in your mind, that because they may have had COVID-19 in June, but they're still experiencing severe health effects, then the emergency really didn't end.
Yeah, that makes sense.
So I think the onset piece is where it kind of gets hung up, right? If it's the way that the language is, the onset of the emergency, I think you would tie back to, the original event of getting COVID. But if it's an ongoing emergency, how would you put that on the application so that it would get approved?
So it's very likely that you would need to ask your whoever's applying for that. Can connectors apply for the emergency Medicaid?
Yes.
Okay. So your onset of the emergency was more than 3 months ago, but the emergency still exists. Where do you put the date in?
Right. There's a screen. I forget what it's labeled, but there's a couple questions on it, and they ask what's the start date of your emergency. So you have to put in a date there.
Okay. So if the emergency is ongoing, I think you can pick whatever date is suitable.
So like the date that the PE ended.
Well, if that's further than 3 months ago, it won't be approved. But if you can send, right, if there are individuals that have had this issue and are still without coverage, I urge you to reach out to me directly with that. But we can't completely take the emergency Medicaid application back further than 3 months at this moment in time.
The most recent, like the case where this came up recently, happens to be within the last 3 months, but so I think we can get this case worked out. But I think the concerning part is that there are probably cases like this where people lost their PE and maybe didn't have a connector, didn't know, just didn't get connected, and so lost coverage that they could have had is what concerns me. Which is why the provider education is important. And I'm wondering if you all have posted the brochure that we shared.
I'd like to say yes, but I will have to look on the website to confirm that, to be quite honest with you.
Yeah, it would be good to have that confirmation. And if there's a place that it's posted publicly, if we could have the link, then we'll share that link, because there's more authority in having it posted on DMS's website. And if we can share that with providers, that would be really helpful. And I think, to Miranda's point, obviously there's a concern for people who have this gap of coverage. There's also, though, to me, what you're saying, Lee, about using an ongoing date, I think is a great solution for people who, moving forward, or even who may have a situation right now. And the individuals that may have experienced more than a 3-month gap, but if they're still having an emergency condition, it sounds like they could at least get back onto emergency Medicaid, even if that doesn't, take care of the months that they didn't have coverage. But ongoing, it could probably
Yes.
be the solution.
Yes.
So the next issue is how do we make sure people know that they can do that? And I think that would require a language change on the application. In particular, individuals can also apply for emergency Medicaid through the application. But I don't think that they would feel that it was, accurate to put in a different date than the date of first diagnosis. So can we work with you on a language change?
We are not going to, we can't change the application without CMS approval. Okay. So-
Oh, yeah, understood. I mean, it was.
So, right. I can let you know that certainly we'll take your advice. And when we get ready to change the process on emergency Medicaid, we will reach out to you about that. How's that?
Okay. I think that would be a big help and definitely
And no-
clarify things moving forward.
Yeah, I agree that not everybody's going to know these things, but I don't know. It's beyond me how to explain to all of the public what to do on the Medicaid applications. I do not believe that I'm asking or advising anyone to do something they shouldn't do when they're looking at the ongoing emergency of just because it began with a diagnosis of COVID-19. This is where I would really need to lean on frontline people. That's what I'm trying to say. Frontline people who talk to the public every day and who have contact with undocumented individuals to let me know what kinds of things we would need to say in order to get that message across. Just because it's not, I don't know, it seems clear to me. I was a little bit surprised that I had to explain it to you all.
Yeah, I think
I would have
that,
thought you would have figured it out, actually.
well, we try not to have system workarounds that we don't think are accurate. But I like the way that you're interpreting this, and I think
Neither do I. I'm not advising you or
yeah, no,
giving you
I
advice
understand. I think
on doing anything that's inaccurate.
right. It's an ongoing emergency is legitimate. No, I understand. I think the onset is where everybody got stuck.
Okay.
Just thinking onset meant
Okay.
literally onset.
So- Yeah.
It's
So
okay.
here's how I would think of it. If I still can't breathe, I kind of think of that as an emergency. Right. So, or if, and that's the biggest, or the loudest symptom I've heard of is not being able to breathe still, after having that COVID diagnosis, now being COVID virus free in your bloodstream, but you still can't breathe. So I kind of think that that is an emergency in and of itself. That's what I mean.
Yeah, no, I understand what you're saying, and I think that it makes a lot of sense. I'm glad that you clarified it for us. So we'll do what we can to get the word out, but I do think, changing the language moving forward as you're working on other changes to emergency Medicaid would be really helpful. So it'll be great to have that opportunity.
Sure.
Anything else, Miranda, before we move on? Okay.
No.
So then you had brought up the maintenance of effort a little bit earlier, Lee, and we're just wondering what planning is going on, what system changes are in place or going to be put in place as you're working to recertify Medicaid members.
Well, okay. When the public health emergency ends, the state will have 12 months, at least that is the guidance today, we will have 12 months to, as everyone has phrased it, unwind the twisted up eligibility system that we've all gotten ourselves into because of the pandemic and the flexibilities and the maintenance of effort, etc. So we are planning on taking that 12 months and doing data analysis on our current at that when the public health emergency ends. When I say current, you know, we're talking about when it ends. We do data analysis every other week or so to make sure that we're still in the same ballpark of what we believe we're going to be in. But as for the actual numbers, we won't know that until we get notice that the public health emergency is ending. So what our plan is at a very high level is to take the entire caseload and redistribute the recertifications across the year, across the 12 months. So because we've been in the public health emergency, to even out the workload, that would be the point of redistribution, is to even the workload out so that we don't have a month with 20,000 recerts and a month with 100,000 recerts, etc. So that we have a manageable workload across every month, which will, you know, make it different than it was in 2019. However, we are hoping to do that. We are hoping that we will be able to still manage the the passive renewals the same way we have been, and that we'll still have 75 to 85% success rate with passive renewals. And then, of course, the active renewals mean that we have to send a notice, pre-populated form out to families in case, you know, head of household or individuals, so they can recertify. CMS has offered a lot of guidance about things that we could do to prepare for this, such as trying to make sure that we have updated, current, and correct addresses and phone numbers and email addresses. To that end, we have already changed the greeting script and some of the scripts in our call centers to ask, while we have you on the phone, can we confirm that this is your current address and phone number? So we have been we've been engaged in that practice for maybe close to 6 months now, maybe not quite 6 months. The other thing is that we are going to be putting together a communication strategy to start outreach. I believe our Medicaid and HPE and connectors and advocates will all be assisting in that communication strategy to do outreach, to let folks know that when the public health emergency ends, we will be needing to recertify cases. As it was pointed out, it's something I hadn't thought about until a few weeks ago. There are folks who are enrolled in Medicaid now and have been for perhaps over a year, who had never had Medicaid before and before the public health emergency, and therefore have never been through a recertification. So they don't even understand what that might mean. So we'll have to do a little bit of education along those lines. And I believe that one of our biggest partners in that will be the MCOs, since the largest portion of our population will be or is currently enrolled in an MCO. So as far as what we're doing systematically, we are looking at things like low-hanging fruit. So by that I mean cases that where we've already moved to do things like where we had folks in 2 different TOAs at the same time because it wasn't clear to us that we could move them when they may be aged out or when they received Medicare. We're taking care of those issues behind the scenes, and we'll have those things done by the time we get to the hopefully end of the public health emergency. So the biggest load will be the recertifications.
The recertifications.
Yeah.
Yeah, this is really helpful. Thank you. When you brought up addresses, that really got my attention because I have been hearing that some people who are updating their addresses in Connect or with the assistance of a connector, the address or their contact information, even the spelling of their name, is still being overwritten by MMIS in some cases. I don't know if that's happened with you, Miranda, but I know it's happened with some other connectors.
Okay, wait a second. Overwritten by MMIS?
I'm assuming, I mean, they're putting in an update and it's not sticking. It's not, the update
Okay,
goes back to the old information.
okay. That doesn't have any, first of all, doesn't have anything to do with MMIS.
Well, that was just an assumption on my part.
Yeah, just to let you know, nothing comes from MMIS into, no information flows from MMIS into worker portal or self-service portal. So it all flows the other way. Send me an example.
Okay.
That's news to me that people are changing their information and it's not staying. Just off the top of my head, I can say that it may be that their identification, although that shouldn't happen. So we have a master client index that is supposed to hold the one true identity of folks and have all of their misspellings or abbreviations or shortenings of their name, William to Bill,
Right.
Bobby to Bob, and Robert, to have them all connected under one specific ID. But I don't know why that would change their address. Sometimes it might, we might have somebody in with a different name spelling, and if it doesn't match when somebody tries to correct it, that may get overridden by a data steward. But there's a process for that.
Okay. Yeah. So I'm understanding now that it's a different master index, but still could potentially have the ability to override. So we'll get you some examples. I think
Okay.
it would be helpful for us to just troubleshoot that in case we can fix that before, lots and lots of people are having to recertify. And the comms plan that you talked about, anything that we can do to help in preparing that would be great. Definitely we'll be helping to get the word out. So I know that we scheduled this to be a shorter meeting because we are doing it in a month that we're not usually meeting, and DMS has other TAC meetings this month. And so your schedules are probably pretty loaded. Just really quickly want to get some updates on the 1915C waivers. Any updates in terms of the HCBS funding that came through ARPA? We know there was a partial approval. We're just wondering what the status is of the final approval.
Hey, Emily, it's Pam. So we have submitted back to CMS there were just a few questions that they had that they requested additional information on and most of them were process related. So it wasn't as much about the things we had put in the plan, but kind of a little more detail around some of the steps or the additional processes. So we've provided that information back to CMS, have not received an answer yet. I know that several states are in kind of the same boat that we are. They've submitted, most of the states had partial approvals and had to submit additional information. And I know there's several that, like ours, are still in review. As far as what we're doing right now is we are working with a consultant that there were several organizations that awarded some money that allowed Advancing States and Riverstone and a couple other consulting groups to provide free technical assistance for developing the project plans for ARPA. So that went from mid-October through, it ends on November 30th, actually, but we're working with our lead right now to finalize kind of our initial project plans. We also are working to get stakeholder sessions and to get those scheduled to go over kind of high level information and to launch possibly a couple more surveys. So we were hoping to be able to do those by the end of this month, but as Thanksgiving is very quickly approaching, I don't know that we're going to have the first session the beginning of November or during November, but we look to having those scheduled before Christmas. So we'll have at least something scheduled in December to talk more high level about it. And the way I want to do those is how we've done some of the other things where we split it out and have a session for providers and then have a different session for participants, family members, or any advocates, just to make sure that those individuals get equal time and that the questions don't get dominated by the providers, because really there's different questions from each group. So we want to make sure that everybody has full opportunity to ask questions and be heard. But we are looking to launch some additional surveys, have that broad level stakeholder meeting, and then potentially have some smaller groups that focus on individual initiatives. So if there's somebody more interested in one topic, have some smaller sessions based on those, looking at starting those probably first of the year.
Okay, great, thanks.
Mhm.
And I'm guessing that you'll put all those dates and descriptions out as soon as you have them publicly.
Oh, well, yeah, Kelly actually is working on, so most of you know Kelly's name and have gotten emails and things from her. So we're working on doing that, kind of outlining a plan and sending it kind of a watch for type email. These are coming up. Make sure you're looking, that you're looking for those. And so, Arthur, I know if there's any questions you have particular after this that you think of, if you want to email them to me, I know you have my email address. So if you just want to reach out to me when you have time, if you want to email them, if you have additional questions, or when your regular aide is back, if you want to do that, that's fine.
Yeah, thank you, Pam, for those updates. And I think we're all looking forward to more of the information, sessions and.
Oh, great.
Oh.
Oh, yeah.
He said, okay, all right.
Great, thanks. So we have a couple other items on the agenda. Just one question that we brought up at a former meeting. Can DMS provide a diagram of Medicaid and K-CHIP eligibility? Is that something you all have or could put together for us?
Veronica and I were talking about that this morning, and we recalled that we had promised that to you at the end of November.
That sounds right.
Okay, so we're working on that.
Okay,
Thank you.
great. And then do you all know the status of Humana's doula benefit and how many doulas are currently in network? I know this is an add-on benefit.
We've asked Humana to address this. Is someone from Humana on the line? On the meeting?
Hi, this is Kathy. Can you hear me?
Yes.
Okay. Currently, and we had sent this information also in with our response, I think earlier this year. It's not per se a network. We don't require referrals or anything. If a person goes to a doula, then we accept that. If that answers your question, it's basic. The way it works is that the enrollees can work with the mom's first care managers that we have, or they can work with our enrollee services to be connected with a doula if they don't have one or have one in mind. And we currently allow 2 visits for prenatal and 2 visits for postpartum, and that's being increased to 4 each during the upcoming year. But those claims will come through and we pay those out. So I can't give you an exact number of how many doulas there are in Kentucky because they don't register like providers do.
Yeah, I think that may be part of the question, you know, how do doulas get paid by Humana so that they can perform these services? What do they need to do in order to, you know, be a Humana enrolled doula, I guess?
And we don't enroll doulas necessarily. It's not the same, quite the same as a provider, but they submit a claim. And there's information, of course, on our website around that. And then we pay the claim out. We don't necessarily enroll them into a program. Am I answering your question? I feel like I'm not answering.
I think so. Whenever, I guess I'm wondering if a Humana enrollee wants to have a doula, finds a doula, will the doula know that they will be paid for their services in advance, or do they only find out once they bill? Like, is there a reason that
we don't turn down anyone because they don't have to be enrolled? So they just have to be willing to bill Humana Healthy Horizons in Kentucky for reimbursement at the published rates. And then they will bill us directly, submit a claim for the service that's received. And then, of course, it has to match up with what's available for that benefit. And then they will receive reimbursement directly from Humana and not the enrollee. Does that help?
I think so. I will go back to some of the doulas who have had questions and see if that clarifies things. And if not, maybe we can set up a meeting offline.
Absolutely. We would be more than happy to meet with them. Do you know, is the ones that are asking questions, are they with a particular group or are they random?
It's an assortment of people. Yeah.
We are more than happy to have a meeting with them to help clarify. We did send the information that I'm sharing with you to Angie, and I'm sure she's shared it already. But if there's any more that I can send, I would be happy to. As far as, do you think that having the claims address where to submit it, or do you think they may not have some of those things?
You know, I think maybe knowing that not having been approved as a Humana, you know, enrolled doula, that they can rely on being reimbursed, I think is probably a holdup. But yeah, we can talk a little bit more, you know, outside of this meeting. And Angie, I apologize if you sent me something and I missed it, but I don't recall seeing that information. I'll do a search in my email to see.
No, I be happy, Emily, but I will.
Okay, all right. I sometimes fall behind and things get lost. So,
well, survive.
Yeah, that means you're like everybody else. That's the rest of us too. I think.
I'll send it to you right now before I forget.
I have that feeling whenever I just totally miss something. But that's really helpful. Thank you, Kathy.
Absolutely. I hope I answered. And if once you get the information, if we can provide anything else to make it easier for them. But at this point in time, they just have to be willing to submit that bill to Humana.
Okay.
And they will get reimbursed at the published rates as long as they are providing services through this benefit.
All right. Yeah, that's helpful. So the next item on our agenda is recommendations. I have a few thoughts, but nothing like fully formed. And some of this, especially what we talked about in terms of enrollment and recertification barriers, it seems like we just need to take the next step of kind of digging into that with DMS. So does any other TAC member have a recommendation that you want to put forward right now? Or are you good with kind of waiting until December to form those? We will have a meeting in December.
I'm okay to wait.
Okay, yeah. Anybody else? So then I have as our meeting schedule, our next meeting will be December 14th. Arthur? Did you have something you wanted to add? Or did you say you wanted to wait? To wait, I think. You went on mute. Under new business in February. Oh, yes, I was actually going to put transportation on our December meeting, but do you want to wait until February? Wait until February? Okay.
So Emily, I may be able to, with knowing that's coming up, may be able to, if we wait till February, be able to have some more information. Maybe too. So I'll keep that down, that's something upcoming, and that way we can maybe have more information so we can have a better discussion about
That
it in
sounds great,
February.
Pam.
Okay.
That sounds good. Thank you. So we will have our meeting in December. We'll wait to address transportation until our February meeting. You can see that our next MAC meeting is actually on Thursday this week. So I'll turn my report around really quickly. And then proposed meeting dates for 2022. These are the dates that would still, conform to what we do now, the third Thursdays at 1:30. So I don't see any, obvious conflicts here. And of course, if there is a conflict, we can always reschedule one meeting. But any concerns about these meeting dates? Okay. Then I will ask for a motion to approve our 2022 meeting dates.
I make a motion to approve the 2021 dates.
And Arthur seconds. Thank you, Arthur. All in favor, say aye.
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 Any opposed? Okay, motion carries. Thank you, everyone. And with that, we will adjourn. I will be in touch about getting, agenda items for our December meeting. So keep those in mind, and we'll make sure to get all of those things on our agenda. And if you have recommendations that you have kind of in your mind and you want to discuss those, we can do that between now and then as well. All right. Thanks, everyone.
Stay safe.
Have a good day.
Thanks,
Bye.
everyone.